Chemotherapy is a type of cancer treatment that uses one or more anti-cancer drugs as part of a standardized chemotherapy regimen. Chemotherapy may be given with a curative intent, or it may aim to prolong life or to reduce symptoms. Chemotherapy is one of the major categories of the medical discipline specifically devoted to pharmacotherapy for cancer, which is called medical oncology. The term chemotherapy has come to connote nonspecific usage of intracellular poisons to inhibit mitosis or induce DNA damage, which is why inhibition of DNA repair can augment chemotherapy. The connotation of the word chemotherapy excludes more selective agents that block extracellular signals. The development of therapies with specific molecular or genetic targets, which inhibit growth-promoting signals from classic endocrine hormones, are now called hormonal therapies. By contrast, other inhibitions of growth signals like those associated with receptor tyrosine kinases are referred to as targeted therapy. Importantly, the use of drugs constitutes systemic therapy for cancer in that they are introduced into the bloodstream and are therefore in principle able to address cancer at any anatomic location in the body. Systemic therapy is often used in conjunction with other modalities that constitute local therapy for cancer, such as radiation therapy, surgery, or hyperthermia therapy. Traditional chemotherapeutic agents are cytotoxic by means of interfering with cell division, but cancer cells vary widely in their susceptibility to these agents. To a large extent, chemotherapy can be thought of as a way to damage or stress cells, which may then lead to cell death if apoptosis is initiated. Many of the side effects of chemotherapy can be traced to damage to normal cells that divide rapidly and are thus sensitive to antimitotic drugs, cells in the bone marrow, digestive tract, and hair follicles. This results in the most common side effects of chemotherapy: myelosuppression, mucositis, and alopecia. Because of the effect on immune cells, chemotherapy drugs often find use in a host of diseases that result from harmful overactivity of the immune system against self. These include rheumatoid arthritis, systemic lupus erythematosus, multiple sclerosis, vasculitis, and many others.